Hi, nice to meet you all. My name is Dr. Ragavan. I'm a Uro-Oncologist. I'm a specialist in urological cancers. Today we are going to talk about kidney cancer, or also told in medical terms as renal cell cancer. We have two kidneys in our body, and their primary job is to produce urine. Cancers do occur in the kidney, but thankfully it is not as common as prostate cancer. However, interestingly, in South Asian population, namely India, Pakistan, Bangladesh, we find kidney cancer to be equally important as much as other cancers in the body. Like many cancers, kidney cancer in the early stage does not show as any symptoms. If at all, you may have a vague abdominal pain or extremely rarely blood in the urine. But the majority of the patients, at least today, is diagnosed with kidney cancer just because they had a scan or a checkup done. That is one of the important reasons I tell patients doing a master health checkup on yourself at least every year from the age of 40 will be a good idea. Because if you have kidney cancer or a tumor in the kidney picked up in the early stage, then it is possible to remove just the tumor and leave the kidney back, the functioning kidney back, so that you still have 1.5 or 1 3/4 of a kidney still working for you. This is very important in our context, in the Southeast Asian context, in the South Asian context, because we are the diabetic capitals in the world. We have the highest amount of diabetic patients, and diabetic patients do have effect on the kidney. So it is very important to identify any kidney problem early on and deal with it effectively so that the adequate amount of kidney tissue is still preserved for the patients for their future. Right. How to diagnose kidney cancer? As I said, majority are asymptomatic. The majority of the cancers, if not all of them, are diagnosed by what we call imaging, radiology. It just starts with an ultrasound scan, which is a screening test which may tell that there is probably a tumor, and that is substantiated by something called a contrast enhanced CT scan. In some patients where it is not possible to give the contrast scan, we diagnose it using an MR scan. In the majority of the patients, when there is a tumor in the kidney, we assume that it is likely to be cancer, and across the world, most of us do not do biopsy of that tumor. There will be exceptional circumstances which you can discuss with the local doctor to see whether a biopsy is required in your particular circumstance, but as I said, the majority will not require biopsies. The moment you see a tumor in the kidney, the best solution for that is to remove it. Surgery is the best time-tested solution for kidney tumors. That surgery may mean that we remove just the tumor and leave the kidney, or in some advanced cases or for technical reasons, the whole kidney has to go, called radical nephrectomy. Removing part of the kidney is called partial nephrectomy. Okay, now that we have done that operation, does the patient need further treatment like chemotherapy, radiotherapy? Answer is, in the majority, those patients does not require any further treatment at all. Only in those patients who have advanced disease, spread disease, further treatment using special medicines such as TKI inhibitors or immunotherapy may be indicated for them. How to remove part of the kidney or whole kidney? That can be done by three techniques: by an open surgery, or a laparoscopic surgery, or very modern technology which is robotic surgery, whereby you make 4-5 holes, the kidney or part of the kidney is removed, and if you remove part of the kidney, it is a complex surgery where we stitch everything back to make sure everything is put back to its normal self. Can we prevent kidney cancer? Well, we do not know what are the reasons why kidney cancer happen, but we know that smokers have an association towards kidney cancer. So if you are a smoker, that is something you could consider to stop in order to see whether you can prevent a kidney cancer in future. So stop smoking, be aware, Do not hesitate to get your health checkup done on a regular basis, and if diagnosed, don't worry. It is a treatable condition, if not a curable condition. Have a good day.